Hello, everyone. My name is Dr. Shobha Jagadeesh. I'm a physician, an internist, board certified in obesity, and welcome to Medical Queens, founded by Jaya Daptardar, my good friend. Medical Queens Got Talent is offering health and wellness talks by healthcare experts. We are raising awareness of the health and wellness issues impacting people all over the world. Hope these health and wellness talks will help educate them and provide resources and information to use to overcome their health and well-being related challenges. These talks are for educational purposes only, and I would like to begin with that obesity is very close to my heart. For some reason, I've always loved and wondered why we in medical school just don't get enough training to treat this chronic illness, which impacts almost every aspect of life and every health aspect, mental and physical. So I'd like to talk about, I think we all sometimes use the word very loosely. So I would like to say that I don't want to offend anybody by using the word obesity, but it is a medical terminology. And the essence of it is excess body fat, which leads to unhealthy outcomes. So there are various methods that we can use to diagnose obesity. One, commonly when you go to the doctor or you weigh yourself, something called body mass index, where you can weigh it's calculated by kilograms in weight divided by your height in meters square. No need to rack your brain to calculate. Google will do it for you. But on average, more than 30 for anybody is considered obesity. But interestingly, in the Asian population, which includes South Asians, the number is actually more than 27. And we'd be surprised how many people walking around who you would not think has excess body fat does come under that category of obesity. It doesn't take a lot. So those are a couple of ways. And the other method is calculating percent body fat. There are a lot of machines and tools that can be done, like calipers and DEXA scans. And diagnostically, for men, more than 25%, and for women, more than 32%. So more than 25% body weight in a male is considered having a diagnosis of obesity, and more than 32% body fat in a female. Now, to put body mass index into perspective, because sometimes we all look at our scale, and that's really the easiest tool to go by, looking at your weight, even though sometimes we can have excess body weight, be healthy, and that can be due to higher muscle mass. But that's generally less common. And an average person who exercises regularly and does moderate weights, BMI is pretty reasonable. But some examples of heights and weights, and I'm going to start off with women who are 5 feet, because that's not uncommon in the South Asian population. Generally, more than 220 pounds would be considered starting with overweight or obesity. So we need to be between 120 pounds or less. If you're 5'2", you don't want to be definitely more than 130 pounds, and so on and so forth. If you're male, if you're 5'4" male, upper limit is 140 pounds, 5'6", 150 pounds, 5'6", more than 150 pounds, you shouldn't be more than, and 5'9", more than 160 pounds. All of this is approximate. This is ideal, but honestly, from wherever you are, and if you have excess body weight, any improvement is a bonus. We know that improving your body weight by just 10% reduces your risk of diabetes by probably 50 to 60%. So that's huge, because once you have the diagnosis of diabetes, which is also preventable, there are added risks to that. 4 times higher heart disease, higher disease of vascular disease in your feet, retinopathy in your eyes, kidney disease, and so on and so forth. But what does excess body weight impact is what I want to discuss. So we all went through the pandemic. Obesity, excess body weight above BMI 30 led to many more deaths for COVID-19 during the COVID-19 period, especially in that very, very delicate, stressful period when there were no medications. We didn't know about masks and everything was just new in 2000. Many people who did not have hypertension, who did not have diabetes, died from COVID-19. And I think this is a moment of reflection for us to just remember that how life is unpredictable. And if there's an aspect we can prevent to improve our health, that's one of them. Stress. Stress impacts weight hugely. We know that there are hormones in your brain that just get escalated, and with that our appetite can go up, and with our appetite going up, we just eat randomly. We're all human. Hormones play a huge role into our eating habits. So and I don't want to forget that especially people who have clinical depression and just stress per se, and eating disorders like binge eating disorder, to name a few, and night eating syndrome, where people randomly get up in the night and they're unaware and they eat, all of those impact obesity. So when somebody comes, we have to remember, as physicians and as just friends, we can't be judgmental on why somebody has excess body weight. There are many, many factors. And I wanted to bring those two in because we tend to forget about that, and they're equally important. Then I'd like to talk about a couple other aspects which are something we can deal with regularly when you go to the doctor or when you see your blood work. I'd like to divide the impact of obesity in two ways. Number one, the physical aspect, where if you can imagine when you hold weights and when you hold a baby, even in excess 5 or 10 pounds, how long can we even hold a little baby? We actually have to put the baby down. I don't know anybody, even a newborn, who can actually hold one all without having some aching in your arm or some difficulty after a while. So if we can imagine our own selves, if we have an excess 5 pounds, then it goes up to 10, goes up to 20 over time, how much that can impact us physically. So, and this is easier to imagine because it's just like sort of compression. So your joints get compressed and osteoarthritis starts in the knees, can start, your hips. Your mobility gets impaired can get impaired, I should say, because everybody manifests differently, but you can't really walk as quickly and rapidly as you could. And we see that as we get older, especially our balance gets impaired. And these factors actually have a huge role to play in falling for the elderly population. Then we have the bladder. I've had numerous patients who've come back and said that, Dr. Jagadeesh, since I lost the weight, I don't have to get up to use the bathroom in the middle of the night anymore. I really don't need to change my pads in as much anymore because they don't leak, and it's not as embarrassing for them because it's an embarrassing symptom to have. And we have to remember that urinary incontinence is actually not normal no matter how old you are. If you have leaky urine or urinary incontinence for any reason, please seek out help. It can be weight related, but there are other reasons also. Then when you have excess body weight in your neck, it manifests as a diagnosis called sleep apnea, where the excess body fat around your neck and inside in the tissue can compress or obstruct oxygen going into your lungs correctly. So some of the symptoms are excess snoring and just not breathing, but then you have to be up to notice that, or somebody has to be up to see that. You're gasping for air sometimes, and you can be just really fatigued. And if you're driving, you can get super tired and just want to like take a break. And these are some of the symptoms, to name a few. And yes, one of the things, you can have high blood pressure. So any of these things, if you've noticed in yourself, or if your spouse or family member have noticed, please seek out help and get tested, because sleep apnea is treatable. Yes, of course, if it is weight related, which is a very common reason, losing weight, seek help for that if you're unable to do it on your own. But of course, there are other medical reasons for that as well. And then the heart, just imagine your body weight is just compressing your chest. So can compress your heart, leading to, restriction of your heart, making your blood pressure higher, and your heart has to pump so much to help that excess body weight that you have, and that is a stressor for your heart. So people can go into heart failure more often, and as a result, you can be more short of breath, your legs can swell up, and you can have or require more pillows to sleep with, sleeping more upright. Another diagnosis that gets worsened or gets propagated is asthma, because your lungs get restricted. The excess body weight in all directions is restriction of your lungs. So that's common that asthma improves with weight loss. So all of these things that I'm saying are all aspects that can be improved. Then we have metabolic causes. And when we say metabolic, there are things that occur within our body that we cannot see. They're not tangible, but when you go to your doctors and they say, I noticed your blood sugar being a little bit high, or your cholesterol being a little high, or your blood pressure being slightly high, but not terribly high. All of those are parts or effects of excess body weight, obesity. So one is we call metabolic syndrome, where it's a constellation of your abdominal girth being higher. And to put that into perspective, for Asians, for males, if you've around your umbilicus, if you measure yourself more than 33 inches, and in women more than 29, that actually fulfills the diagnosis of obesity. And for the non-Asian population, more than 40 inches in men, more than 35 inches in female. And it's shocking for a number of numerous patients when I tell them, everybody understands when you explain everything else. So those are the constellation of symptoms: high blood pressure, high triglycerides, high LDL, blood sugar being a little high, pre-diabetes and diabetes. Pre-diabetes, your fasting blood sugar being between 100 and 126, diabetes, fasting blood sugar more than 126. But I think more commonly being used now and relatable is the hemoglobin A1C, where it averages your blood sugar over several months. And if you're pre-diabetic, even a 5.7% is diagnostic of pre-diabetes, and there are aspects of your health that you could improve to resolve that. Diabetics, you have to be 6.5% and above, but really pre-diabetes is not far from diabetes. So whatever you do for diabetes, you're going to do for pre-diabetes, including sometimes medications. Then we have another part of or effect of obesity is fat deposit in your liver. So sometimes you can have a little abdominal pain, or most of the time no symptoms, but when you go for routine checkups, you see that your liver enzymes are slightly up and sometimes terribly off. And either or can be just mild fatty liver deposit. Medically, we call it hepatic steatosis, or non-alcoholic steatohepatitis, but simply it's fatty liver. Fatty liver can actually lead to cirrhosis, and there is a misconception that cirrhosis is mostly because of excess alcohol intake, but that's not so. Right now, the number one reason for liver transplant is fatty deposit in the liver due to obesity, not due to alcohol intake. So we really need to take this seriously. And high blood pressure. And actually, I do not want to forget this. Cancer risk exponentially goes up for many types of cancer, common ones being colon, breast, and all the female organ cancers, ovarian, breast, so commonly related to excess body weight. Of course, could we all get cancer even if you don't have obesity and you have a normal weight? Yes. But, in medicine, everything is not black and white. So whenever we talk about the majority of people. So those are some of the effects, right? And I know many of you may know this, but I just wanted to stress this before we talk about things we can do for it. And I don't want to leave without saying that no matter what condition you have, and maybe nothing, maybe your blood work is stellar, Your life expectancy in general is 10 years less when you have excess body fat. And I think most of the reason is because of all the conditions I talked about, but sometimes can be nothing. And that's also because um, there's inflammation that goes on within our body as a result, and we cannot measure them on as well. So what can we do for this? And I think many of us know, but we are human. Many of us know that we have to eat right, exercise, um sleep well. Lack of sleep is a big cause because we tend to get hungry when we don't sleep well. But all easier said than done, right? So from children, uh it's probably a good idea to start with instilling good habits. But since I deal with adults, and I'm assuming there are more adults listening to this, it's all doable. I have 75, 80-year-old patients who've worked so hard for the last couple of years, and they have brought their body weight down, maybe not to normal, but again, as I said, their pain in their knees have reduced significantly that they don't need knee surgery. Their blood sugars have come down so much that they're no longer diabetic. I've been able to take people off of their medications. I've been able to either reduce blood pressure um, pills, I mean, the number of pills or doses of medication, or stop diabetic medication. So it's very rewarding for patients to just see those numbers come down and feel better about themselves. And just be able to run around with your grandchildren, enjoy just walking. And there's a huge impact in quality of life. So I do want to say that because it's a chronic illness and there are many hormones involved in within the paradigm of obesity. Hormones start from stress hormones I talked about before, would just like make you hungry. But also, like, we have hormones in our body fat, leptin. We have hormones within our stomach, ghrelin. Ghrelin makes you hungry. That's why a lot of people, once you've had surgery, you've had some of that removed, you don't get hungry. You just can't eat as much to a point. And I'll talk about that in a bit. But at important aspect is those hormones, which are basic and they're numerous, involved all in your small intestine, some in your large intestine as well. But all of these hormones, like GLP, GIP, just to name a few, but all of these hormones are connected, and all of them are connected to your brain. In your hypothalamus, there's a huge center where you get hungry, and the hunger also improves, and all of them are connected to the hormones in our stomach, our body fat, and our gut. So when we lose fat, we also lose the good hormone called leptin. And when we lose the leptin, it actually can make us hungry. So I tell patients all the time, please don't take it personally. It is not you. Many people, actually, in fact, the majority of people, as they lose weight, for whatever reason, whether it's from surgery they've had or on medications or on their own, there is a tendency to get hungry. And that's normal. But that's where habits come into play. And we as physicians can help. If somebody is certified in obesity, it may be even more helpful. But you keeping up with that, checking your weights regularly, maybe once a week, and being very self-aware will actually help you, because when you start getting hungry, don't blame yourself. It's your body, it's physiology. It happens to most people. Then we just have to remember how to tweak our diet, how to improve, get that significant protein, fat, fiber in. Most of us, if we're in that path of wanting to lose weight, you need about 100 grams of protein a day, close to it. You need a certain amount of fat. And of course, lots of vegetables more than fruit, because fruit has sugar. Nothing wrong with fruit. It's always good, but everybody's different. Every human's different. Sometimes the sugar in the fruit can impede your path to losing weight. So that's why people, like physicians who are certified, are helpful. And there are also a lot of health coaches outside there who are helpful. But keep that in mind, because what you ate before may not work for you now. And the same type of exercise. Exercise, everybody needs 150 minutes a week. You can divide it into 30 minutes, 30 minutes, 5 times a week, or divide it however you want. But however you want to exercise, and even if you don't get those minutes, any progress is progress. I always tell my patients who've never exercised, just get into the habit of 5 minutes a day. Go down your driveway, come back. Just get into habit. Simple steps. Habits are not easy to acquire. Habits take minimal 20 days, but probably more. So just do things that are going to get you to that path. Simple. So start with just 5 or 10 minutes if you've never exercised. If you already exercise and you're doing the right amount, then I would say just exercise. Do one thing you love. 5 minutes. Next week, 10 minutes. Oh, maybe it's not so bad. Go 50 minutes. Maybe you're getting bored. Maybe then ask a friend, will you join me? Ask your husband, ask your daughter, ask your son. But anything that makes you happy and makes you want to move. The other thing I want to say is that in exercise, we call it NEAT, non-exercise activity thermogenesis. Any activity, say you park your car far when you go to the grocery store. If you're doing laundry, don't ask your kid to do it. You if you're able, you do it. Take that basket of clothes that you folded, walk upstairs. That helps. My pet peeve is just parking your car far. Even if it's Costco, you know how much you have to walk in Costco? Imagine all the way parking at the back, walking into Costco and walking all around. That gets you there, at least part way. So any movement is movement, whatever you have to do and whatever you enjoy. And gradually over months, you can improve that. Diet. When you want to improve your diet, you can't just suddenly stop eating junk. That's not easy. First of all, don't go to the grocery store hungry. Second of all, shop in the periphery. And thirdly, de-junk your house. A very common problem is that the significant other wants to eat junk, can't get off that path, and that is going to be enticing you. That will take willpower, but I can promise you there are ways. Ask whoever that is in your house, have their own little spot out of your sight. If you want to eat that junk, you eat it, but keep it away from me. Stock up on protein and fats. They physiologically improve the cravings that are stimulated from your brain. So please keep things handy. Keep protein powder handy. If you're somebody who's too busy to make a protein drink with fruit or whatever, just get healthy protein shakes. There are many out there. Just to name a few, Fairlife, Orgain, just to get you started. Don't have to be on those forever. Paneer is great. Very satisfying, high in fat, a good amount of protein. There's nothing wrong with rice. And I don't want to get on this path of saying do or don't eat anything, because that's not in my position right now. Everybody's different. But there are various schools that of methods that can help you. There are some people who do methods through Indian organizations where they say don't eat dals because they can be weight gaining, they can cause bloating. But I think what's common, what I see everywhere, is less sugar, including in fruits. If you're able to, don't kill yourself, and just more protein and fats. And then it's a process. It has to be sustainable, be slow and steady. Make one small change every week. Maybe the first week, stop getting yogurts that have sugar in them. The second week, just eat more vegetables. Have them prepped. If you can't prep them and it's affordable, buy the chopped food. And if you can, get help. Get help at home. Somebody to chop your vegetables. Whatever you can do just to enable you to get to that path. And then I don't want to not talk about medications and weight loss surgery, because I myself would never want to be on one if I didn't have to, but there are people who need it. And that's why we have doctors, and that's why we have professionals who can help you. If you need medications, please don't resist. Everybody does not have a side effect. Please don't Google. Don't go by information from Facebook. Maybe there are some things out there that are legitimate, but please make sure you have valid resources and make an educated decision. And I say that because I have way too many people who continue to suffer because they insist that they don't want to be on medications, even though they've been seeing me for a year, or they insist they don't want to have weight loss surgery when they have genetics involved because their parents were obese, their sisters are obese, but clearly they're unable to sustain. But their body mass index is more than 40, very, very high. And they suffer from arthritis in their spine, suffer from blood pressure despite 4 medications. And, we're trying to help, but they are their own enemies because they just don't want to go that path. And I understand there is stigma, but please make an educated decision before you just decide you don't want one. There are doctors that you can, people who can, and who can do good surgeries, and people do well. There are people who do really well after surgery. I've not been able to recognize some of my patients who had surgery and sustained it for years because they've just stayed on that path. And I don't think they've worked that hard after a while because it just becomes second nature from habits. But many people who've had surgery or who have not had surgery need medications, and don't resist if you need them. Some are metformin, some are GLP-1 agonists like semaglutide or Ozempic, well known as. Some, if you're diabetic, you can get Mounjaro, but there are medications like topiramate that can help cravings. They're used for multiple other things. If you've never had a side effect, you can't have a side effect without trying it. So I do encourage trying one if you need one. Again, I'm not being a pill pusher. Yeah, so those are some of the things. All medications may have side effects, but don't be afraid to try something if you will benefit. And remember, if you're doing great, we can always get off of multiple medications. People sometimes need 3 or 4. We treat obesity as a chronic illness. If you have a thyroid condition, I'm sure most of us will be on a medication. If you have high blood pressure, I'm sure many of us would be on a medication. If you have Cushing syndrome, again, steroids can cause excess body weight, but you can get Cushing syndrome because of medications you need, for example, for rheumatoid arthritis. But these are all medications that treat the condition. So why not treat such a common condition like excess body weight, which just needs to be treated? We would have less heart disease, less strokes, less cancer, less complications from COVID-19, and we would just be a better world, a better, healthier world if we just created good habits and just be open-minded to treat obesity. Thank you all for listening. I hope this was helpful, and I hope this jogged some neurons in your brain to start thinking about what you can do, or maybe even for a loved one. This may be not for you who's listening, but maybe it's for somebody else you could help, including children. So thank you so much. And it's my pleasure to speak to you all. And thank you so much to Jaya for inviting me. And